In today's video, we're going to be using the Kenhub Atlas of Human Anatomy to learn about the inguinal canal. And then we're going to jump on over to the Kenhub website and we're going to put that information to the test. So the first thing we're going to do is open our Kenhub Atlas of Human Anatomy to the abdomen section on page 228. And that's where we're going to find the inguinal canal. Now, you're going to take a look at this picture and immediately recognize that there is a lot more than just the inguinal canal here. So let's go ahead and orient ourselves, but I want to first start with where is the inguinal canal, and that's going to be located right here. But to understand what the inguinal canal is, we need to understand the surrounding area. So what you're looking at here is basically the right lower quadrant of the abdomen, as well as we're seeing the hip. So you can see like this rounded portion here, this is the head of the femur as it's plugging into the acetabulum on that os coxa, but we're seeing a lot of soft tissue. You're also seeing an empty abdominal or pelvic cavity right here. What should be located here, which has been removed in this image, is part of the large and small intestine. So you can kind of picture like the cecum of the large intestine with the appendix coming off and then kind of moving into the ascending colon, as well as possibly some small intestine right here. So to understand what the inguinal canal is, we're going to first take a look at these abdominal body wall muscles here. So we can see the external oblique. Then we can see, you'll have to look really closely at this, but there's actually 3 layers of muscle here. You have the external oblique, the internal oblique, and then we have the transversus abdominis. And then we're going to see this yellow layer here. This is called the transversalis fascia. And what it does is it comes all the way around to down here, which is going to be very important because it helps to form, the boundaries of the inguinal canal. And you can see the muscle is kind of looping down here. And the inguinal canal is actually going to go through them. It perforates them. They form like the roof and the walls, the boundaries of this inguinal canal, along with that transversalis fascia. So we can also see that something is coming out of the inguinal canal right here. Now, it's easy to kind of get mixed up and assume this is part of the inguinal canal, but this is actually the spermatic cord, which tells us that we are looking at a male anatomy here because the spermatic cord is only going to be associated with males. Now, that doesn't mean that females don't have an inguinal canal. They do. It's just that with males, the inguinal canal also serves as the point of traveling for the spermatic cord. Now, the spermatic cord includes multiple structures. So we have like testicular vessels and nerves. You're also going to have what's called the ductus deferens. In fact, the ductus deferens we can see emerging right here and looping around. So the ductus deferens is what carries sperm from the testes all the way, or more accurately the epididymis, but from the testes and epididymis all the way to the prostate, which would be around in this area. So this is a very important structure that is traveling through the inguinal canal. So what you'll see is that right here, this is what's called the superficial inguinal ring. So if they took the time to say superficial inguinal ring, then there must be a deep inguinal ring. And in fact, we can see that right here. And if we follow it over, it's kind of hard to tell, but there is a ring. This is the entry point that the spermatic cord would be going through. So we have a deep inguinal ring and a superficial inguinal ring. Now the spermatic cord is also going to be wrapped in fascia. And so you can see this external spermatic fascia here. And there's also blood vessels on top of it. This is what's called the pampiniform plexus. So you can see part of it right here. So these are testicular veins. So this is blood kind of like returning from the testes, and it's going to be traveling on that spermatic fascia, and it's going to come all the way up, and then we can actually see it kind of going up here on that external iliac artery right here. So it's kind of hard to tell, but there's some blue right here. That's part of the testicular vein, or what's also known as the pampiniform plexus. So, but if there's an external spermatic fascia, there's also going to be an internal spermatic fascia, and that's going to be this right here. So again, what we're doing is we're forming kind of like this entire boundary for that inguinal canal to go through. But you can also see it's traveling through that transversus abdominis and that internal oblique muscle as it's moving towards the inguinal ligament. So the inguinal ligament is something you probably recognize. If you think to someone who is really fit, they have that cut V in their lower abdomen, that is the inguinal ligament. This is connecting this upper portion of the hip called the anterior superior iliac spine all the way down to the pubic tubercle. And this serves as an attachment site for these abdominal muscles. But what happens is right on the edge of it, that's where the inguinal canal opens, and you can see the spermatic cord exiting. By the way, to kind of like give you an idea of what the inguinal canal also serves for males, it's also where the testes descend. This happens in utero, but the testes will originate all the way up here in the abdomen, and then they will burrow their way through that inguinal canal before they drop into the scrotum. This is also the reason, or one reason, why males are more susceptible to an inguinal hernia. Now, a hernia could be intestine, it could be fat, it could be like peritoneum. There's all this soft tissue here. Basically, when you have a larger inguinal canal, it makes it possible for something to push through. And so if something is pushing through, then we call that an inguinal hernia. And again, it could be intestines, could be fat, but that's a product of the testes creating a larger inguinal canal as they are descending down into that scrotum. So if we come up here, we also want to look at, let's see, the testicular artery. So the testicular artery is also, it's really going to be hard to see, but there is an artery coming here. And if you recall, arteries are going to deliver oxygenated blood, or really, I mean, typically oxygenated blood, not always, but typically, down towards the testes in this case. So we have a testicular vein and we have a testicular artery. Again, that's going to be providing blood to and from the testes, but we can also see these really massive ones. So again, you can see the femoral artery and then the femoral vein. This is going to be bringing blood to the inferior limb, and then the femoral vein is going to be bringing it back from the inferior limb. And these are going to connect to those external iliac arteries and veins, and that's going to then connect to the aorta and the inferior vena cava, respectively. But that is pretty much everything that we can see here. So what we're going to do now is we're going to jump over onto the website and we're going to take a quiz to see how well we are understanding this entire area. Okay, so the quiz has loaded, and how this is going to work is we have our image, and then we're going to see a green highlighted portion. And it's just going to like bounce around from that image that we were looking at, and then you're going to see our available options here on the right. And so first off, we have this one right here. I don't know if you can see this. You're always welcome to pause the video, zoom in if you need to, do whatever you got to. But is this the inferior epigastric vein, the internal iliac vein, the genital branch of the genitofemoral nerve, or is it the common iliac vein? So this one is the common iliac vein. Common iliac vein. All right, so we have another blood vessel. By the way, a real quick and easy tip is when you're trying to identify these, look at the color of the blood vessel. If it's red, it's an artery. If it's blue, it's a vein. Now you're like, Justin, I already kind of gathered that because you can see every single one of these are ending in artery. Still, when you're self-orienting yourself like that, there's something powerful in that process. It kind of just jolts your memory and just kind of puts you in the right place at the right time to kind of start figuring this out on your own. So regardless, this is going to be an artery. So is this the inferior epigastric artery, the deep femoral artery, the common iliac artery, or the right external iliac artery? So again, it starts here, goes down. Again, you can pause it if you need to. So this right here is the right external iliac artery. Okay, so we have another blood vessel. So this time it's this little tiny one down here. Is this the deep femoral artery, the right external iliac artery, the common iliac artery, or the inferior epigastric artery? Again, so we know it's an artery, but see if you can also just, another quick tip is like, I always tell my students, if you don't know what it is, maybe start with what you do recognize, and then you can kind of build out from there. Like, I know I gave us 5 minutes, but don't feel like, oh, I need to rush through this, right? It's more about understanding the material than necessarily hitting the time limit. You can always take another quiz. So instead, it's like, try to figure out what you know, and then sometimes that can lead you down the right path to what you don't know, or to at least remind you. So this right here is the deep femoral artery. All right, so again, we have another blood vessel here. So this giant one here in the back in green, is this the femoral vein, the testicular vein, the right external iliac vein, or the femoral branch of the genitofemoral nerve? Now, I already told you it was a blood vessel. I'm realizing I shouldn't have said that. I mean, like for these three it works, but now it kind of cancels out. the nerve aspect. But at the same time, you know, like, I think, again, that's a simple thing. Like for me, as soon as I see these images, I just hurry and go like, how big is it? You know, like that's a huge thing, because really small yellow types of vessels, those are going to be nerves. So regardless. So this right here is going to be the right external iliac vein. All right. So this one is a little difficult to see. So there's like this really narrow line going through. And this was also very difficult to see in the image in the physical atlas. So I'm going to kind of look right next to me. So is this the cremasteric artery, the testicular artery, the internal iliac artery, or the femoral artery? Again, this is really small and narrow, but this is going to be the testicular artery. Okay, so now we have this little thing swooping over like this. So the question you want to ask yourself right now, is this a blood vessel or is it not a blood vessel? So the thing is, it's highlighted as green, so it's like you don't know if it's yellow, you don't know what's going on. But the options are, is it the ductus deferens, the fascia lata, the inguinal ligament, or the external spermatic fascia? So this one is going to be the ductus deferens. That's the tube that transports sperm from the epididymis all the way to the prostate. Okay, so now we have this one right here. Let's see if we can get two more. So let's go fast. So we have this one right here. Is this the transversalis fascia, spermatic cord, lacunar ligament, or the iliac fascia? That is the iliac fascia. Okay, so the last question, going as fast as we can. So we have this massive one. This is going to be easy to see. Is this the external spermatic fascia, the fascia lata, the inguinal ligament, or the ductus deferens? So what's nice is we know it's not the ductus deferens because we just saw that. So that is through process of elimination, you should have landed somewhere around here. So option is, or the answer is, I should say, the fascia lata. And so it's going to go ahead and take us out. And what's cool is it kind of also can tell you just how much content is discovered, your knowledge increase, everything with it. You can even see like a detailed report. Like, really excited about our new quiz mode. Really recommend every single one of you check it out. Thanks for watching, everybody. Hopefully you enjoyed watching today's video and you learned something interesting about the inguinal canal. I personally feel, and obviously I'm going to be biased, I mean, this is a Kenhub video, but I honestly feel this is the best way to learn human anatomy. If you're able to pair a study session with the Kenhub Atlas, and then you're jumping over to the website, you're reading an article, you're taking the spaced repetition quizzes, you're watching the videos, you're navigating the digital atlas that we have on the website. Like, the way we've kind of constructed everything, there is absolutely no reason that you can't come away from a single study session knowing far more about the material than you did before you entered. I think it's personally the best way to study human anatomy in 2025. So be sure, go ahead. We'll leave links in the description below for you to check out the website as well as the Kenhub Atlas of Human Anatomy. But hopefully, again, you enjoyed today's video, and I'll see you in the next one.